Introduction. The COVID-19 pandemic is one of the virus that has been spread throughout the country and causes many problems. This virus is a very dangerous virus and can be the causes of person death. The coronavirus is a single-chain RNA genome with an enclosure. Familiar symptoms include fever and breathing problems such as chest tightness. In advanced cases, this tightly contagious infection can lead to pneumonia, severe acute respiratory dysfunctions, and kidney problems. Following existing coronavirus interaction, the risk of infection can last about 2 and 11 days, but it can last up 14th day. COVID-19 pandemic. This coronavirus disease can also be known as COVID-19. The virus was first detected in the city of Wuhan in December 2019. The first city to be infected with the virus is China. The spread of this COVID-19 occurred very rapidly and has spread throughout the world. This made all countries experience a very severe pandemic and can affect the state of the country. The COVID-19 pandemic is one of the pandemics that can directly affect public health. There are various measures that can be used by community to prevent being infected with COVID-19 virus. Among the steps that should be taken care is, if sneezing, the person should use their elbows to prevent the spread of the virus. First ever COVID-19 issues was discovered on March 2020, and also the first tragedy was clarified on March 18, 2020. Following that, the government of Bangladesh enacted a lockdown from March 26 to March 30, in addition to controlling the transmission of the COVID-19 virus. This pandemic produced many impact and challenge to the country. This pandemic has pretty much left the economy and the state of the country in a state of disarray. Global trade has been estimated to continue to decline by 5.3% in 2020, but expected to increase by 8.0% in 2021. The number of low-income individuals will rise by 2% for every single percent of global economic slowdown. In addition, during COVID-19 pandemic, Bangladesh is already dealing with other issues such as social stigma, fear and dread. The shutdown impact general healthcare treatments method in hospital and private clinics. Next, I will explain about solutions. Good strategies and solutions can make the country survive no matter what issues and problems arise. First point is help women through training to improve their skills in micro development. This is intended to help them from being affected by the problem of large-scale job loss. The local government divisions, LGD, the Commonwealth and Development Office, FCDO, and the United Nations Development Programme (UNDP) launched a specially constructed training programs aimed at approximately 21,000 young girls and women in the state. Next point is block all flights from Europe to prevent the occurrence of viral infections. Anyone entering the country will also be required to quarantine for 14th day. Bangladesh has also declared that a 10-day lockdown will be implemented starting from March 26. With this lockdown, all types of movement are not allowed at all. Any activities such as business, education are also restricted except for the medical needs and also daily expense such as kitchen items. In conclusion, although the country of Bangladesh have a pretty promising economy before the onset of this pandemic, the country also faced obvious challenges due to this prolonged pandemic. The pandemic that hit the whole country can also show the pattern of decision making by the government. The government played a huge role during the pandemic. Although there are various measures taken by the government to prevent the country from being severely affected, the people of this country still do not comply with the rules that have been set and prefer to be selfish.